Okay, welcome to the deep dive. We're tackling a really specific challenge today from veterinary medicine, something your sources get into with some fascinating detail. We're looking at urolithiasis, stone formation, specifically cystine urolithiasis in dogs
Yeah,
and sometimes cats.
that's right. You've gathered some really solid material, articles, research, notes, and our job here is to, unpack all that for you.
Yeah, pull out the crucial bits, the surprises, maybe those aha moments to really get a clear picture of this condition.
Exactly. Let's dive in. So first off, what exactly are these cystine stones? Why do they even form, according to your sources?
Good place to start. The sources say they're, well, stones made of cystine forming in the urinary tract.
Yeah.
But the root cause isn't just like diet or something simple.
No, not primarily. The
Ah.
core issue that the sources identify is this underlying metabolic problem.
A metabolic problem. They call it an inborn error of metabolism. That sounds, well, significant. What's that actually mean for the pet?
It means it's fundamentally genetic, a hereditary defect. And it messes with how the kidneys handle certain amino acids. Normally, kidneys filter blood, then pull back the important stuff.
Right, like amino acids. But with this condition, cystinuria, that pulling back process, the reabsorption, it's faulty for some specific ones.
Exactly. The sources consistently name four: cysteine, ornithine, lysine, and arginine, often just called QLA, the acronym.
CoA. Okay, so these CoA amino acids, they get filtered out fine by the glomeruli, the kidneys filters.
Yes, they pass through that initial filter, no problem. But then when they get to the next stage, the proximal tubules, which are supposed to grab them back,
That's where the defect is. The transport mechanism for CoA doesn't work right.
precisely, that specific transport system is broken.
And the result, according to the sources,
Well, you get abnormally high levels of these CoA amino acids left floating around in the urine instead of being taken back into the body.
got it, high CoA in the urine.
Yeah.
But why does that lead specifically to cystine stones, not CoA stones?
Ugh, good question. This is where cystine's specific properties come in, as highlighted in the sources. Out of those four CoA aminos, cysteine is by far the least soluble in urine.
Least is soluble. Yeah.
And that lack of solubility gets much, much worse when the urine is acidic, particularly a pH below about 7.0.
Right, so it's like trying to dissolve sugar in iced tea versus hot tea.
Yeah.
The acidic urine just can't hold on to the cysteine.
Exactly the idea. So when the cysteine level in that acidic urine gets too high, higher than its solubility limit, it starts to precipitate out.
It forms crystals.
Yes, tiny little crystals first. And then those crystals stick together, aggregate, and eventually form those macroscopic stones, the uroliths we're talking about.
Okay, so it's a chain reaction. Genetic defect, faulty kidney transport, high urine CoA cysteine precipitates out, especially in acidic urine stones. Makes sense. Your sources also mentioned something interesting, that even though these amino acids are lost, it doesn't usually cause, like, nutritional deficiencies in dogs.
Yeah, that's right. Unless protein is really, really restricted in the diet, they're considered non-essential for dogs. But the sources do flag a specific concern for cats.
Oh, what's that?
Well, cystinuria is very rare in cats, but if they do lose excessive arginine, another CoA amino acid, it could potentially make them prone to something called hyperammonemic encephalopathy.
Hyperammonemic encephalopathy.
Yeah, sounds serious.
It's neurological.
It is. And one other quick point from the sources, some dogs with cystinuria might also have carnitinuria, losing carnitine too, another transport issue.
More complexity. Okay, so the big picture here is it starts with genetics affecting the kidneys, and cysteine forms stones because it just doesn't stay dissolved well, especially when the urine's acidic.
That's the fundamental process the sources lay out.
Now, knowing what they are and how they form, let's look at who gets them. Is this just a random risk for any dog or cat?
The sources are quite clear on this. While the genetic condition, cystinuria, is the prerequisite, not every animal with cystinuria will form stones. It's a major predisposing factor, but you need those other conditions too, like the right urine pH and concentration.
Okay, so it's predisposition plus environment. Are there specific groups the sources point to as being at much higher risk?
Definitely. Particularly in dogs, it's overwhelmingly adult males. The average age is around 5 years, but the sources stress it can range from just a few months old right up to 14 years.
Wow, that's a huge range. But why the strong male bias? Do the sources explain that?
They do. They suggest two key reasons, especially for intact male dogs. First, male hormones might influence how the kidneys handle cysteine, maybe increasing how much gets into the urine.
Okay, hormones. And the second reason?
Anatomy. The male urethra is just longer and narrower than the female's, so if stones do form, they're much more likely to get stuck and cause a complete blockage.
Right, the plumbing makes obstruction more likely. Hormones and anatomy, kind of a double whammy for intact males.
Yeah.
How many breeds are affected? You said it was widespread.
The sources say over 80 breeds have been reported with it, but there's definitely a list of breeds where it's seen much, much more often.
Okay, let's tick off some of the main ones your sources highlight. English bulldogs seem to be number one.
Yes, English bulldogs are consistently listed as the most common, but others frequently mentioned are Newfoundlands, Dachshunds, Labs, Mastiffs, Scottish Deerhounds, Irish Terriers, even Chihuahuas, Pit Bulls, French Bulldogs, Basset Hounds.
That's quite a list.
It is. And it's worth noting, some breeds like Newfies and Labs can even show signs when they're really young, under a year old.
Really drives home the genetic link. And
Yeah.
speaking of genetics, the sources actually break it down into different types, right?
They do. Based on the specific gene mutation involved, they describe 3 main types in dogs. Type 1 is autosomal recessive, involves the SLC31 gene, and you see it in breeds like Newfoundlands, Landseers, Labradors.
Okay, type 1 recessive.
Then type 2 is autosomal dominant, different gene, SLC7A9, found in Australian cattle dogs, some miniature pinschers.
Dominant, okay. And type 3.
Type 3 is described as having sex-limited inheritance. It's linked to breeds like Mastiffs, Scottish Deerhounds, Irish Terriers, though the sources add a little note that some forms classified as type 3 might actually pop up in females too, not just males.
Interesting nuance there. So, multiple genetic routes to the same stone problem. Does knowing the specific type change how vets treat it? Or is it more for, like, breeding advice?
Mostly for breeding advice and understanding how it's passed down in certain lines. The actual management of the stones, once they form, tends to follow similar principles regardless of the type, although the sex-limited nature of type 3 does tie into why castration might be particularly helpful in those dogs, which the sources touch on later.
Right, makes sense. The genetics explains the why and the risk, but the treatment focuses on the stones themselves. What about cats? Is it a big issue for them too?
No, actually, your sources really emphasize that it's extremely rare in cats.
Okay, that's generally good news for cat people.
Definitely. When it does happen in cats, it also tends to affect adult males more often, but females can get it too, unlike the really strong male bias in dogs. The age range is similar, maybe a bit younger, on average, around 3.5 years.
Any specific cat breeds mentioned?
Mostly domestic shorthairs and Siamese cats are listed in the sources.
And even though it's rare, have they found a genetic link in cats like they have in dogs?
The sources mention one recent finding, a specific mutation in that same SLC3A1 gene, the one involved in dog type 1, was identified in a cat with cystine stones. So it suggests the underlying mechanism is probably similar, just, much less common.
Okay, so rare, but likely the same kind of genetic root cause. So wrapping up this section, Cystine Urolithiasis, strong link to a hereditary metabolic defect with major predispositions for certain breeds and especially intact male dogs.
That sums up the risk factors nicely based on the sources.
All right, we've covered what they are, how they form, who's at risk. Now, what signs would someone actually see? Where do these stones cause problems in the body?
Well, the signs can vary quite a bit. Depends on where the stones are, how big they are, how many there are. And the sources point out, sometimes animals can be totally asymptomatic, showing no signs at all.
Really? No signs. Where do they usually end up lodging then?
Most commonly, they're found down in the urinary bladder. Those are called cystoliths, or in the urethra, the tube leading out urethrolyths. Less often, they might be higher up in the kidneys or the ureters.
So if they're in the bladder or urethra, the lower urinary tract, what are the classic signs the sources describe?
You'll see signs of irritation or partial blockage. Things like peeing more often, maybe small amounts each time, polyuria, pain or difficulty urinating, dysuria.
Ouch.
Yeah. Blood in the urine, hematuria is common too, and straining to pee, stranguria. Sometimes the sources say owners might actually see small, smooth stones being passed. Oh, and urinating in inappropriate places can also be a sign.
Okay, those sound uncomfortable, but maybe not immediately critical. But there's a major complication that the sources really stress, isn't there?
Yes, absolutely. The big scary one, especially for male dogs, because of that anatomy we talked about, is urethral obstruction, a complete blockage.
And the sources label this a life-threatening emergency.
Unequivocally. Needs immediate vet care, no waiting.
What does that blockage look like? What are the absolute emergency signs owners need to recognize from the sources?
The key sign is the dog is straining and straining to pee, but nothing is coming out. Zero urine.
Okay, straining with no result.
Exactly. Along with that, you'll likely see signs of severe belly pain. The dog might become very lethargic, start vomiting, and could even collapse as toxins build up.
And that buildup happens fast.
Very fast. The blockage leads to post-renal azotemia waste products backing up in the blood because the kidneys can't flush them out. If it's not relieved quickly, it progresses to uremia, where those toxins start poisoning the whole system.
Understood. Straining plus no urine, your emergency. What if the stones are higher up, like in the kidneys or ureters?
Those upper tract stones, nephroliths and ureteroliths, are often silent killers, sort of. They might not cause any obvious signs unless they actually cause a blockage higher up.
What would that look like?
Signs might only appear if they cause hydronephrosis, that's where the kidney swells up with backed up urine, or if they contribute to overall kidney damage and insufficiency.
Okay, so let's say someone sees some of these signs, especially straining, maybe in a predisposed breed. They suspect cystine stones, based on what the sources describe. How do vets actually diagnose this? What are the clues and what makes it tricky?
Yeah, diagnosis is definitely a puzzle, piecing together different bits of information. And the sources emphasize you always have to rule out other things that cause similar urinary signs, plus other kinds of stones, like struvite or oxalate.
What are the main diagnostic tools the sources talk about?
A really crucial starting point is the urinalysis, looking at the urine under a microscope. Vets are specifically looking for those characteristic cystine crystals.
How are they described in the sources?
As six-sided or hexagonal, they're typically colorless and flat. Pretty distinctive looking.
Sounds like a dead giveaway.
It's highly suggestive, yeah. But, and this is a really important but, from the sources, you don't always find the crystals in the urine, even if the animal has stones.
Oh, really?
Yeah, and just finding crystals doesn't automatically mean stones have formed either. So, suggestive, but not proof positive on its own. The urine pH is also key, usually acidic, less than 7.0, which fits the picture. You might also see blood, protein, maybe some white blood cells.
And infections.
They usually do a urine culture too, check for bacterial infections. But the sources note that UTIs are actually less common with cystine stones compared to, say, struvite stones.
Is there a specific chemical test mentioned for spotting cystine in the urine?
Yes, there is. It's called the sodium nitroprusside test. It's a qualitative test, basically checking if there's a lot of cystine present.
How did that one work?
You add a reagent to urine that's been made alkaline. If it turns a kind of burgundy red color, that's positive, suggesting high cystine levels. But again, the sources say it's suggestive, not quantitative, doesn't tell you exactly how much.
Okay, so urine tests give clues.
Yeah.
But to actually diagnose stones, you need to see them. What did the sources say about imaging cystine stones?
This is where it gets really challenging, and the sources highlight this repeatedly. Cystine stones are poorly radiopaque.
Poorly radiopaque,
Right.
meaning they don't show up well on regular x-rays, is that right?
Exactly. They can be super faint or sometimes completely invisible radiolucent on standard x-rays. The sources compare their density. Kind of similar to struvite or silica stones, definitely less dense than calcium oxalate or phosphate, but denser than urate stones.
So normal x-ray might just miss them entirely.
Easily, especially if they're small or not very dense. Larger ones might show up, but you can't rely on plain x-rays alone.
What about ultrasound then? Does that help?
Ultrasound is helpful. It can detect cystine stones, even if they're invisible on x-ray. It's good for looking in the bladder, the urethra, checking the bladder wall thickness, and also for seeing if there's hydronephrosis suggesting a blockage higher up.
But
ultrasound doesn't reliably tell you what the stone is made of, its mineral content, or give you a perfect picture of its shape.
so x-rays might miss them, ultrasound sees them, but not perfectly? How do vets get a definitive look at these tricky stones, according to the sources?
The sources stress that contrast radiography is often essential. This involves using contrast dye. Techniques like a positive contrast cystogram filling the bladder with dye or a retrograde urethrocystogram dye in the urethra and bladder make the stones show up.
How they appear then?
They look like filling defects, basically dark silhouettes against the bright white contrast material. It outlines them.
Is there one single best imaging technique overall, according to the sources?
Yes, the sources generally point to a CT scan as being the most sensitive method. It's best for detecting even tiny stones and really assessing the extent of any blockage.
Okay, so you've got clues from urine, maybe seen something on imaging. But what's the absolute gold standard, the non-negotiable step for confirming it's cystine based on your sources?
Urolithianalysis,
Yeah.
without a doubt. You absolutely must get a sample of the stone, whether it's passed, naturally removed, surgically flushed out, whatever, and send it to a specialized lab for quantitative mineral analysis.
Quantitative analysis.
Yes, the sources are emphatic. This is the only way to be 100% sure it's a cystine stone. And crucially, that analysis dictates the entire long-term prevention strategy.
That link between analysis and prevention seems critical. What about genetic testing? You mentioned the different types earlier.
Right. Genetic tests are available for many of the predisposed dog breeds now. They can identify the specific mutation type I, IIA, IIB, type 3. The sources say this is useful for confirming the diagnosis, especially maybe in a young dog from a high-risk breed, before they even form stones, definitely for breeding advice, and for identifying individuals who need close monitoring.
Any common red flags on routine blood tests?
Generally, no. Standard blood counts and biochemistry panels are usually pretty unremarkable unless there's a complication like that post-renal azotemia from a blockage. Serum calcium, for example, is typically normal, which helps rule out some other stone types.
Okay, so let's say the diagnosis is confirmed it is cystine urolithiasis. How do you tackle treatment based on the sources? Can you just dissolve these stones with a special diet like some other types?
That's a really, really important point the sources make, and a major difference from stones like struvite. Cystine uroliths cannot typically be medically dissolved using the standard prescription urinary diets by themselves.
Ah, okay. So no easy dietary fix for existing stones.
Right. It's not like struvite where diet alone often works.
Yeah.
The approach for cystine, outlined in the sources, is basically twofold. First, you've got to get rid of the stones that are already there, especially if they're causing problems or a blockage.
Step 1, removal.
Step 2, and this is absolutely vital, is implementing a serious, lifelong medical prevention plan to stop new ones from forming, because the underlying genetic issue isn't going away.
Okay, let's talk removal first, especially that emergency, the urethral blockage. How is that handled?
That's a life or death situation, so it's all about immediate stabilization, IV fluids, pain relief, followed by relieving the obstruction ASOP. Often, vets will try retrograde urohydropropulsion.
That's the flushing technique.
Yeah, using a catheter and sterile fluid to push the stone back from the narrow urethra into the much wider bladder where it's less immediately dangerous. If that doesn't work or isn't feasible, sometimes an emergency surgery called a urethrotomy is needed to cut into the urethra and remove the stone directly.
Got it. What about stones that are just sitting in the bladder, not causing an acute blockage? How are those removed?
Several options are discussed in the sources. For really small stones, like under 3 or 4 millimeters, they might try voiding urohydropropulsion.
How does that work?
It's done under anesthesia. They fill the bladder up with saline, hold the animal vertically, and then carefully squeeze the bladder to try and flush the small stones out through the urethra with the stream of fluid. The sources say it tends to work best in female dogs because their urethra is shorter and wider.
Sounds like it needs careful technique. What's the most common method?
The most common and definitive way to remove bladder stones, according to the sources, is a cystotomy. That's traditional open surgery, making an incision into the bladder and physically removing the stones.
Are there less invasive ways mentioned?
Yes, especially at referral centers. Minimally invasive techniques are becoming more common. Things like cystoscopy-guided laser lithotripsy.
Using a laser to break them up.
Exactly. Delivered through a tiny scope inserted into the bladder, or basket retrieval, where they use tiny graspers, again guided by a scope, to grab and pull out smaller stones or fragments.
Okay, so various ways to get the current stones out. But that doesn't solve the underlying problem. So that lifelong prevention strategy is really where the long-term focus has to be.
Absolutely. This is the marathon part. It's lifelong and involves hitting the problem from multiple angles. The main goals are to make the urine environment hostile to cystine crystals, increase cystine solubility, decrease the amount of cystine being excreted, and keep the urine really dilute.
How does diet fit into that, based on the sources?
You have to use specific prescription diets. The sources mention ones like Hill's prescription diet or Royal Canin Urinary UC Low Purine by name. These are specially formulated for cystine prevention.
What's special about them? How do they work?
The sources explain they tackle several things. They aim to reduce protein levels, which means fewer precursor amino acids, including methionine, which gets converted to cysteine. They often restrict sodium because some studies, especially in humans, suggest high sodium intake can actually increase cystine excretion by the kidneys.
Interesting link with sodium.
Yeah. And critically, these diets are designed to promote alkaline urine. The target pH mentioned is often greater than 7.5. Remember how poorly cysteine dissolves in acid? It's much more soluble in alkaline urine.
Makes sense. What else?
And finally, they're formulated to increase water intake and produce very dilute urine. The target urine-specific gravity is usually less than 1.020. This is why feeding the canned version of the diet or adding extra water to the dry kibble is really emphasized in the sources as being key. Dilution is pollution, for the crystals anyway.
And avoiding high-protein treats or table scraps would be crucial then, too.
Definitely. Strict adherence to the prescribed diet is important.
Is the diet usually enough on its own to get the urine pH high enough, above that 7.5 target?
Often, no. It helps, but it might not be enough. So adding a urinary alkalinizing medication is frequently necessary. The drug usually recommended in the sources is potassium citrate, given orally.
Why potassium citrate specifically?
It helps raise the urine pH effectively. The sources suggest it might be preferable to sodium bicarbonate, partly because of that potential negative effect of extra sodium on cysteine excretion we just mentioned, based on human data. The dosages mentioned vary a bit, maybe 40-75 milligauss up twice daily, or another source says 7,550 milligauss once or twice daily.
Yeah, how do you know if it's working?
This is vital. The sources stress that regular urine pH monitoring at home by the owner is critical. Using pH strips on fresh urine samples several times a week initially, then maybe weekly, to make sure they're consistently hitting that target pH above 7.5.
Wow, that's a big commitment for the owner.
It really is. Now, if diet and potassium citrate still aren't enough to prevent recurrence, or if they're trying to actually dissolve existing stones medically, that's when the other drug comes in.
The thiol-containing one.
Yes. Thioli is the brand name, or the generic, is 2-mercaptopropionol glycine, often called 2-MPG or tiopronin. This is considered the main medical option for dissolving stones, although it takes time and dedication, or, more commonly, for preventing recurrence in difficult cases.
How does that drug actually work on the cysteine?
It's pretty clever. The sources explain it undergoes something called thiol disulfide exchange. Basically, the drug molecule binds directly to cysteine in the urine, forming a new mixed disulfide compound.
And this new compound
Is much, much more soluble in urine than cysteine itself, so it gets flushed out easily, effectively reducing the amount of free insoluble cysteine available to form crystals and stones.
What kind of dosages are we talking about, and are there side effects?
Dosage depends on the goal. For attempting dissolution in dogs, the sources suggest higher doses, maybe 15-20 milligrams twice a day, always alongside the diet and alkalinization. Dissolution, if it works, takes time. One study mentioned an average of 78 days, but it could range from weeks to many months. It requires frequent reimaging.
And for just preventing recurrence?
For prevention, lower doses are often used, perhaps 5-10 milligrams twice daily. In cats, where it's used much less, studies looked at doses around 12-20 milligrams twice daily, and the sources noted minimal recurrence and no reported side effects in those small studies.
Is this drug easy to get? Is it expensive?
Thioli itself is an orphan drug, which can make it pricey and sometimes harder to source consistently. The generic tiopronin, or 2-MPG, is usually obtained from compounding pharmacies, which might be more accessible but still carries a significant cost.
Okay. And the potential downsides, the side effects?
While the sources say side effects are generally uncommon in dogs, they can occur. Things listed include reversible blood issues like a specific type of anemia or low platelets, sometimes effects on the kidneys like protein loss, muscle problems, changes in behavior like aggression, or elevated liver enzymes. So monitoring is needed. And for cats, the sources really caution that safety and effectiveness aren't well established due to limited use.
Right, use with caution in cats. Did the sources mention anything else regarding management, like castration?
Yes. Specifically for dogs with that type 3 sex-limited inheritance pattern, one source noted that castration seemed to significantly reduce the recurrence rate of cysteine stones. And for cats, besides cautious use of 2-MPG, using renal or geriatric diets, which are typically lower in protein, was mentioned as a potential strategy to help minimize formation.
And if, despite all this medical effort, a male dog just keeps blocking, is there a last resort?
Yes, the sources mention a salvage surgery called a perineal urethrostomy, or PU surgery. This essentially reconstructs the urethral opening to make it wider, more like a female's anatomy, to allow stones or sludge to pass more easily. It's a major surgery, usually reserved for cases with intractable recurrent obstruction, and it has its own potential complications, like increased risk of UTIs.
Okay, quite a toolbox for treatment and prevention. So, putting it all together, what's the long-term outlook? What's the prognosis for these pets, according to your sources?
The prognosis for actually removing the stones that are currently there is generally rated as good. Surgery or other methods are usually successful in clearing clearing them out.
That's positive.
But the prognosis for preventing recurrence is considered much more guarded. The sources often describe it as guarded to fair, even with diligent management.
Guarded to fair. That really highlights the recurrence issue, doesn't it?
It absolutely does. The recurrence rate is very high. The figures cited in your sources are pretty stark, somewhere around 50% to 70% recurrence within just 1 year if no preventative steps are taken.
Wow, that high.
Yes. And even with dedicated management, the special diet, the alkalinizers, maybe Thiola, the recurrence rate is still substantial, often quoted in the range of 30% to 50%. It really underscores why lifelong, consistent prevention is so incredibly important.
And the main serious risk remains that blockage.
Yes, urethral obstruction is the most common and most dangerous complication, especially in males. Other potential long-term issues include chronic bladder inflammation from the irritation, and sometimes secondary bacterial UTIs can sneak in.
Since it's genetic, does the risk ever really go away or lessen?
Well, the underlying genetic predisposition is there for life. They always have that faulty kidney transport mechanism. However, one interesting point mentioned in the sources is that in some dogs, as they get older, the rate of recurrence might actually decrease somewhat.
Oh, why is that?
The thinking is that perhaps the severity of the cystinuria, the amount of cystine actually being lost in the urine, might naturally reduce a bit in some older animals, but you certainly can't count on that happening.
Right, a small potential positive, but not something to rely on. Given that high recurrence rate, what does the ideal long-term monitoring plan look like? Based on the sources, this seems critical.
Monitoring is absolutely the key to staying ahead of recurrence. First, as we said, mandatory analysis of any stone that's retrieved is step 1 for confirmation. Then, right after removal, you need imaging, x-rays, or ultrasound to confirm all the stones are actually gone. You don't want to leave any behind.
Okay, baseline clear. Then the ongoing checks.
Regular urinalysis and urine cultures are essential. The frequency might be every 1-3 months initially, while things are getting stabilized, then maybe stretching out to every 3-6 months lifelong.
What are you checking for each time?
You're checking that urine pH is staying alkaline, that the specific gravity is low, meaning dilute urine, looking for any reappearance of cystine crystals, screening for silent UTIs with the culture, and maybe periodically rerunning that nitroprusside test.
What about checking for new stones forming? Imaging.
Yes, regular imaging is also crucial, radiographs or ultrasound, depending on the situation. Again, maybe every 3-6 months to start, then perhaps every 6-12 months lifelong. The goal is to catch any new stones when they're small, before they get big enough to cause signs or obstruction. Early detection is key.
Makes sense. Any other monitoring?
Periodic blood work, like a CBC and biochemistry panel, is usually recommended too. Partly to check general health and kidney function, especially important if the pet is on Thiola, and to screen for any potential drug side effects. And of course, if genetic testing identified a specific mutation, that information remains relevant for any future breeding decisions.
Okay, that's a comprehensive picture. Let's bring this back to you, the listener, as we wrap up this deep dive into your sources. We've gone through a lot of complex detail. Why should someone really care about all this?
Well, understanding cystine urolithiasis is really important, especially because it's such a specific genetic challenge tied strongly to certain popular breeds. If you own one of these breeds, or you're thinking about getting one, or maybe you work with dogs professionally, knowing these details helps you provide the best care, ask the right questions, and make informed choices. And beyond the specific condition, it's just a really clear example of how genetics, something inherited, interacts directly with environmental factors inside the body, like urine pH, to actually cause disease. It's quite fascinating biochemically.
It really is. So if we were to boil down all the insights from these detailed sources into the absolute must-know takeaways, what would they be?
Okay, key points. First, remember, this is fundamentally a genetic issue, an inherited metabolic problem. It's not just caused by eating the wrong food.
Right, genetics first.
Second, these stones are tricky. They pose challenges both for diagnosis, being often hard to see on regular x-rays, and for treatment, because they generally can't be dissolved by standard prescription diets alone.
Which leads directly to the third point.
Exactly. Lifelong, dedicated management is absolutely non-negotiable for preventing recurrence. It's a multi-pronged approach. The special diet, usually alkalinizing medication like potassium citrate, potentially Thiola in some cases, and crucially, keeping the urine dilute.
And if that management slips?
Point 4. The recurrence rate is extremely high without strict, consistent management. Owner compliance, sticking to the diet, giving the meds, doing the monitoring is absolutely critical for success. It's a partnership.
What else is vital for owners to know?
Knowing the signs is crucial, especially point 5. Recognizing the signs of urethral obstruction straining with no urine as a life-threatening emergency that needs immediate vet attention.
And the overall commitment involved.
Yeah, that's the last key takeaway. Owners need to understand this requires a significant commitment. In terms of time for monitoring, potential costs associated with diagnostics, medications, maybe surgery, and definitely lifestyle adjustments like strict diet control. And finally, awareness of those breed risks and genetic testing options is really important for responsible pet ownership and breeding.
We've definitely gone deep into your sources on canine and feline cystine urolithiasis today. Covered the genetics, the diagnostic hurdles, the complex management, the prognosis. Quite a journey.
It really is a condition where understanding the why, the genetic basis, and the how, the challenges in detection, and the need for ongoing, multifaceted prevention is absolutely key to managing it well.
So as we finish up, here's a final thought for you to consider, stemming directly from those strong genetic links identified in your sources, especially in certain breeds. Now that we can pinpoint specific genetic mutations causing this, how might widespread genetic screening combined with targeted breeding programs potentially change the landscape for this condition in the future? Could we significantly reduce how often it occurs in those high-risk breeds?
And following on from that, what sort of ethical questions or practical challenges might arise if we start using genetic information much more proactively like that, to guide breeding decisions for pet health on a larger scale?
It's a really interesting question, looking beyond just treatment towards potential future prevention at the population level. Something to think about. Thank you for sharing your sources and joining us for this deep dive.